Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat by the Islamic Medical Association, health professionals that are there to serve you and through this forum to educate and empower you. We welcome you again to another edition of this particular program, and tonight we are honored to have a guest, E.N.T specialist, well known in the community, Dr. Khaleel Ismail, who hails from Gauteng and also is very well known in Limpopo. Assalamu alaikum, Khaleel.
Wa alaikum salam, Yakub, and assalamu alaikum to our audience.
We will be discussing issues around ear, nose and throat. So it's a specialty that covers three areas, which is a bit unusual generally. Last week we had cardiology, and previously we had something on a disease perspective. So today we'll be able to cover some very common issues. And just to start off our programs, it is an Islamic program, so we'll do a bit of a tarbiyah as we thank Allah subhanahu wa ta'ala. We'll start off with the surah Al-Hamza, which is Wailul Likulli. And it's أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ويل لكل همزة لمزة الذي جمع ماله وأدده يحسب أن ماله أخلده كلا لينبذن في الحطمة وما أدراك ما الحطمة وما أدراك ما الحطمة نار الله الموقدة التي تطلع على الأفئدة إنها عليهم مؤصدة في أمد ممددة. We are told in the Quran, and it's a stern warning from Allah, that basically we should not be slandering. And the translation to this particular surah goes, woe to every one of you, the scandal monger and the backbiter, who put up wealth and layeth by it, thinking that his wealth would make him last forever. By no means he will be sure to be thrown into that which breaks to pieces. And what will explain to thee what breaks into pieces? It is the fire kindled in a blaze, that which doth mount to the hearts. It shall be made into a vault over them. We are given many ni'mas and benefits by Allah subhanahu wa ta'ala. And one of the things we forget to realize is that our body is a definite favor from the Almighty Creator. And we are supposed to utilize our body to its fullest and not to abuse it. The ear, the nose, the throat are very vital organs, but sometimes we forget the spiritual element. And the spiritual element is not to misuse what we have. And backbiting is one of those major sins where we tend to fall into this, when we tend to listen to things which are not meant for us, and we are participant in something that is very grave and sinful. And inshallah we will heed to this and utilize what we are given to the benefit for our own spirituality. But now we will move on to the physical side, and we'll talk to Khaleel about ear, nose and throat. Dr. Khaleel, basically these are very common conditions that we encounter when we have problems with the ear, and generally in our general practice we find that it's divided very often into adult and pediatric diseases. And the pediatric diseases that we see very commonly are the ear infections which you see in childhood disease. Right, and can you just perhaps maybe start off this discussion, and maybe we can take it from there before we open up the lines, because this is something that is, I think the viewers will really want to know about.
Definitely, Yakub. I want to take off on a couple of points that you made there with regards to, not abusing the rights of your ears. But I also want to make a comment about one of my very good friends who told me that, you must never take your health for granted. And especially what he was trying to get at was that, you only realize you have got ill health when you become aware of your problems. So what you really want to be is blissfully unaware of your body. So if you're blissfully unaware of your body, you're unaware of the knee pain, unaware of the earache, and I remember that very clearly.
That's a very good point.
Absolutely. Yeah, so we hope you were blissfully unaware of all our body parts of the body. So yeah, E.N.T problems are extremely common. In fact, our professor who used to teach us actually told us that approximately 80% to 90% of all general practitioner visits were probably going to be E.N.T related, especially in the winter months, of course. And in fact, let me just make another startling point that, in fact, that's only 10% of all complaints, because 80 to 90% of all complaints are probably seen to by the pharmacist. So E.N.Ts as specialists, we only see 1% of 100% of all the problems.
Now that's an amazing figure, because if you think at that level, if you only see 1%, then the other 99% are being diagnosed outside the speciality.
Outside the speciality, in fact, probably mostly by pharmacists and by the GPs. So very important.
Okay, so obviously I'm hoping that a lot of pharmacists are watching this program because, and I know today, I mean, it's not like the old days, the pharmacists get some very good skill training, but it'll be good to obviously see what the pharmacists say, and I hope they do call in also if they got some questions in this regard.
I
So
agree,
what would you
absolutely.
say, Khaleel, is like probably the most common condition from an ear perspective in children that gets referred to you?
Oh, you know, hands down, otitis media. Ear infections is by far our commonest referral and self-referral, and in fact, the commonest E.N.T infection that presents to any practitioner.
And generally, can we just start maybe with some symptom signs?
You know, the commonest thing is pain, obviously ear pain, fever, and sometimes a discharge. If it's a suppurative or a ear that's discharging, and it'll usually be discharging pus, that will be another sign.
Okay, and at what age group do you see this most commonly in your experience?
Yakub, we see it across the board. You know, people say there's a higher incidence at the age of about 2 to 3. The commonest we see is during the time when the children start entering preschool or creche.
And what's the most common cause? Obviously it's a germ, right?
Yeah, no, look, the ear infection, otitis media, literally means, otitis means inflammation, and media means middle. So inflammation of the middle ear, but the cause of the middle ear inflammation is usually a bacteria, right? Well, usually a virus or bacteria, but an infection, you're right.
Okay, so are there any particular measures that can be taken to prevent these ear infections? We know vaccines play a role. And then again, we're not only talking about the treatment of this particular condition, but the long-term complications. So perhaps we can break it down to say, are there preventative measures? What are they? And would you recommend them?
Yes, now what we're looking at is essentially risk factor control, right? So the risk factor control, you touched on just one aspect of it, which is infections and viruses and their vaccinations to the viruses. But essentially, it's a whole host of risk factor control. And the common risk factors, I quickly list them to you. The 3 common ones are infection, which is you know, usually at the creche or preschool situation, allergy, and then smoking in the house. And this is important. I'm bringing this up very early on to say that smoking is a risk and can predispose to ear infections. And then you've got about 4 or 5 minor risk factors, such as acid reflux, even in children. The way the babies are actually fed, you know, position of the feeding. If you tend to feed flat, the milk accumulates at the back of the nose, and therefore cause inflammation of the eustachian tube and cause a bit of added risk. Not cause infection, but cause an added risk for the predisposition of infection. Then premature babies at higher risk. And the last one is actually, yeah, well, I'll say bottle feeding is one of them. And the last one is any child who has got a sibling with ear infections or history.
So the smoking thing is a pretty important one. And you're looking at smoking in the house, the passive smoking, so it's one of the major contributing factors.
Yeah, remember, it's not just primary smokers, not just secondary smoke, but it's even tertiary smoke, which means that somebody smokes in the house and then walks out and the child then goes into that room. Okay. So that is also a factor, because that's not necessarily the smoke that increases the risk for cancer, but it's just the irritant in the smoke molecule which causes irritation of the nose, causes a rhinitis, and the rhinitis predisposes to, rhinitis, by the way, is inflammation of the nose, which then predisposes to an ear infection.
Okay, so we track back a little bit now. So obviously now you've mentioned a few risk factors, and one of them is only the germ, the virus and the bacteria. So in terms of prevention, we'll be looking at lifestyle changes for those that are non-germ related.
That's
is
right.
That correct?
Yeah, control of the allergy and
right.
the rhinitis, and vaccination in the appropriate ones to prevent the couple of important bugs that can cause it.
Want to talk about them?
Yeah, I think important ones. Now, vaccination towards most of the major common bugs that cause otitis media, such as Haemophilus influenza and strep pneumonia or streptococcus, can be vaccinated against. And I'm pretty sure the audience is aware of a vaccine called Prevnar, or Prevnar 13, and the HIV vaccine. Right, those are the 2 most common ones. The HIV has been available for more than 20 years, and the Prevnar certainly for more than 8 years in South Africa. And they both are on our what you call it, on our government program for what we would call mandatory vaccination.
So these are mandatory, they're given by government, and people have the option to take it within the public sector, and those that opt, they can get it within the private sector. Obviously, there's a cost difference to that.
That's right.
But it is generally freely available.
Absolutely, 100%.
So we're finding some people are still a little bit reluctant to take these vaccines.
So you're now venturing into a very controversial anti-vaccination campaign.
I think it's important just to hear your opinion.
Yes.
Because I think it's not just in my opinion, to do with the individual choice. Because here we've got to look at responsibility, and this is an Islamic principle to be responsible for the community. Yes. And we can carry the germ if we're not vaccinated without getting the infection, which means then you can pass it on.
Yes, absolutely.
So we've got to be responsible to the community, and that's my view.
Yes. Look, Yakub, I think this goes at multiple levels. First of all, there's the issue of the actual individual choice versus the choice of society. Who it takes precedence, society or the individual? And look, it's my opinion. I must state.
Sure.
But I am actually a pro-vaccinator, and look at strep pneumonia, look at Haemophilus influenza. From an E.N.T point of view, those are very important illnesses. I'll give you an example. Haemophilus influenza was one of type B. Haemophilus influenza, the invasive Haemophilus influenza, was a very, very serious cause of a lethal illness called epiglottitis. And when I was studying when I was specializing in the 90s, we used to see a lot of cases. But in my private practice in the last 14 years, I have not seen more than 2. So obviously the HIV vaccine has made a massive difference. Now, that's just 2 examples. And I'm not even going to get into all the other vaccines such as measles, such as German measles, such as mumps, which are all very relevant, chickenpox, which are very relevant to E.N.T, because they all cause hearing loss. They all cause sensory neural hearing loss. So if we go through, let's say, for example, TB causes important E.N.T problems. Polio, obviously not so relevant to E.N.T, but certainly relevant overall. Then we're looking at HIV, strep pneumonia, we're looking at measles, mumps, rubella, chickenpox, very important to us because those 4 viruses are a serious cause of 2 big problems in E.N.T. One is hearing loss and one is labyrinthitis, which causes dizziness. Right? So obviously vaccination to them would certainly, to a certain extent, prevent those.
So that's a lot of information that you've passed on to us in terms of what complications can arise by not vaccinating.
Absolutely.
Right? So your recommendation is vaccination, right?
Look,
but obviously it is controversial. There are others that choose not to do so, but this is your opinion.
My opinion is that the advantages of vaccination far outweigh the potential, and I have to stress the potential risks that have been highlighted in some articles. So, and as far as I'm concerned, the actual weight of those studies is even questionable.
Okay, we will be going now for a commercial break, and before we do that, I just want to mention the phone line, because the lines are now going to be open, so you can call in and ask all your pertinent questions to Dr. Khaleel Ismail, our E.N.T specialist guest tonight. 011 086 7701 or 2 or 3. The number is there at the bottom of your screen, 011 086 7701 or 2 or 3. We're taking a short break, but we'll be back.
Park Avenue Stationers is one of the leading independent office supplies companies in the country. We are motivated by a strong desire to deliver service excellence by simply doing it better. Get unbeatable prices and select from a wide range of products for all your needs. Printers, paper, office supplies, school supplies, and everything else in between. We are the vendor of choice. Park Avenue Stationers, HB Preferred Partner, your office supplies specialists.
For under 2,000 Rand, you can drive a brand new Toyota Etios Limited Edition. What's more, we'll give you extras worth 20,000 Rand, including a Samsung Galaxy. Yes, you heard right. A new Toyota Etios for under 2,000 Rand with extras worth 20,000 Rand. This offer is only available at Freeway Toyota. Freeway Toyota is situated just off Xavier Street near Gold Reef City. Call Freeway Toyota on 011 661 0000 or go to freeway.co.za for more specials.
Life is full of many joyous moments, and we want to enjoy every one of them. But with time, our bodies just can't handle it because of painful joints. That's why you need OsteoEase Gold, a joint supplement that assists with better mobility, flexibility, and joint health. Live your dreams with OsteoEase Gold, the gold standard in joint care.
At Trend Tap and Tile Ormonde, we offer you the best solutions to your specialized home improvement needs. Just off the M1 highway at the Xavier Street off-ramp. We're open 7 days a week for you. We stock a large variety of top international and local brands, such as Grower, Geberit, Saloni, Summerplace, Libra, Geo, to name but a few, the very best. From exclusive polished porcelain tiles to the latest in sanitary technology. For the very latest and best in exclusive bathroom design, flooring, sanitary ware and taps, visit our exclusive showroom at 262 Crownwood Road, Ormonde, Johannesburg. Trend Tap and Tile, your home, our passion.
You want it, you really gotta have it, cause the Stumbo tastes good like a lollipop should. Movement, you gotta stumble, Speak to the Stumbo. Nothing bigger, nothing better. Go get a Stumbo now. Get a Stumbo now.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat by the Islamic Medical Association. We have our lines open. We've got Dr. Khaleel Ismail, our E.N.T specialist here today. And we have our first caller, so we'll take that call. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. Can you hear me?
Yes, wa alaikum salam.
What's your name?
This is Mr. David speaking. I'm speaking on behalf of my husband, which is 74 years of age. He's a diabetic. He has a continuous singing in his right ear. And that is going on now for more than a month. He has taken some medication over the counter, but it's still persisting the singing in the right ear. I will listen on the TV. Shukran. Assalamu alaikum.
Wa alaikum salam. Khaleel, you want to answer that?
Look, I think that preempted a lot of the other E.N.T problems. You know,
okay. Yes,
whenever we chat about what the singing in the ear is called tinnitus.
Yeah.
And tinnitus is one of our very, very common complaints in E.N.T practice. And in fact, you know, there's alarming stat. At least 70% of people will experience problematic tinnitus at least once in their life, which means it's common. So, but there are a few what you call it pointers for that particular person. And whenever you have unilateral or asymmetrical tinnitus,
you mean one-sided?
One-sided, right?
Okay.
One-sided tinnitus must always be investigated.
What do you mean by investigated?
Investigated means the lady should definitely go and see a specialist E.N.T and have a hearing test done. This has to be done because the list of causes of tinnitus is extremely long, but the minute we have one side being affected more than the other side, we have to exclude something going on. It is pointed towards damage to the inner ear. And because of the risk of diabetes, diabetes is one of the risk factors. You know, I don't know if you're aware that diabetes can cause a mononeuritis, and that mononeuritis can present as a tinnitus or hearing loss. So I think
Dr. Khaleel is saying that the diabetes affects your nervous system like many other systems it affects, and one of the nervous systems is basically within the ear. There's a particular nerve that gets affected by the diabetes, and he's calling it mononeuritis because on one side, mono meaning one.
One nerve, yeah. But in any case, it doesn't matter whether it's on the basis of a mononeuritis or mononeuritis multiplex.
Okay.
Any number of nerves can be affected, and the bottom line is and the age. Because there's, you know, when you sit above a certain age, all the other factors and all the other causes can be put there. And if I mention them all, people will get very scared.
Yeah, sure.
But the important thing to understand is that a unilateral tinnitus, and I think this is, one of the first points that let's put out there, that a unilateral, one-sided tinnitus or a one-sided hearing loss, right, must be seen to by a practitioner. It cannot be seen to by someone who's going to give you eardrops, right? It must be examined. And it must be examined and must be investigated appropriately.
Okay, so sister, basically the message is pretty clear that your husband has to get to a specialist, an ear, nose, throat specialist, either by a referral through your GP or wherever he is getting his care. Please take him through, inshallah. We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
What's your name, brother?
Abdul Hamid from Victoria.
Abdul Hamid, can you go ahead with your question?
Okay, my wife suffered with severe ear imbalancing, and she's a sugar diabetic patient. What is the cure for that?
You want to explain a little bit more what you mean by the imbalance?
Well, she gets a dizziness with that, the imbalancing. So if she's walking, she can't sort of walk straight. She's got to grapple here, grapple there.
And for how long has she got this problem?
It's going on for about 2 years.
Has she seen a specialist?
She has. She is taking Stegrin, but this still carries on.
Okay.
Okay,
100%.
Dr. Khaleel?
Okay, look, Brother Abdul Hamid, look, first of all, first distinction we make as specialists is to make the distinction when somebody says, I am dizzy. Dizzy is a very non-specific term for a vague sense of imbalance. The first distinction we like to make is a distinction between lightheadedness, which is what we would call pre-syncope or fainting-like situation, where the blood pressure goes down or the glucose goes down or something like that.
This will cause the lightheadedness, right?
That's right, yeah. And the second one is vertigo. Vertigo is the subjective sensation of spinning, right? Or rotation or forward, backward movement or rocking or something like that.
Okay, now that happens when she's sleeping, laying down.
Okay, so basically the situation of vertigo is a symptom that is directly related to the vestibular system. The vestibular system is the balance system in your body. Does it make sense? Right. Now, the balance system can be made up of two parts: the brain and the inner ear, right? And the nerve that connects them up.
Right.
So whenever somebody comes with a vestibular problem or a dizziness, the entire system has to be investigated.
I see.
And the causes of that, obviously, unfortunately, medical conditions such as diabetes and hypertension, anemia, all of them, age is extremely important factor, all of them cause your nervous system not to function optimally, right? So we have to separate the non-optimal causes of the dizziness, which are related to, you know, your diabetes not being well controlled, your blood pressure not being well controlled, and all of that, together with what we would call a direct organic problem at one particular point. We would say, roughly term that site of lesion. So we have to separate between the peripheral, which is the inner ear, and the central. The reason why that's very important is because the central usually go to the neurologists. And you need to, and most of the risk factors related to central problems are the same risk factors that would be for heart attacks and strokes. Do you understand what I mean?
Okay, one more thing that's troubling her is anxiety.
Okay, so anxiety is another little layer you're adding on top of that, which aggravates the situation, doesn't cause the situation. Does it make sense?
Right.
It aggravates the situation, doesn't cause it. So now we've got a couple of layers. We've got a layer of age, we've got a layer of diabetes, we've got another, risk, another problem, and hypertension, all of that.
And
anxiety. Right. So now we've got to deconstruct all these little factors and see which is the most dominant factor. And as an E.N.T, we get involved in the peripheral organ, which is the inner ear, which is the vestibular system, which is the labyrinth, which is in your inner ear. And that requires a very specific investigation called a VNG, or a vestibular nystagmography. So what she needs is a VNG and also, for completeness sake, an MRI. Right, because we have to ultimately exclude any problems in the brain as well, because remember, it's one system.
Yeah.
Right. Then, so that's two things that you need to do. You need a VNG and MRI, but the one thing I can certainly tell you, that Sturgeon long term is not good. Sturgeon, yes, absolutely. Sturgeon, what it does is it actually prevents what we would call compensation. Your brain is a continuously adapting system, and the minute you use Sturgeon, you actually prevent the adaptation.
Oh,
right. So you need to.
So what do we use in place of that?
So Abdulhamid, basically, how far have you gone with your investigations with the specialists? Have you seen a neurologist and an E.N.T?
Yes, we have.
And has an MRI scan been done?
That also was done, and they found nothing actually, but this is persistent, you see.
Okay, so the next step is actually to do a VNG, a vestibular nystagmography, to what we would call quantify the dizziness and find the site of where the dizziness is. And then what we would do is we would institute a vestibular rehabilitation program, right? And obviously an audiogram. Sorry, an audiogram is also important because it helps us to determine the pathology or the cause. So that would be the two things. Usually an audiologist.
So our recommendation, Abdulhamid, Jazakallah for your call, is that you'll need to see an E.N.T specialist to take it further, because you've done the MRI with the neurologist, and then the recommendations from Dr. Khaleel can then be taken further. So you'll really have to take her through to an ENT specialist
Yes.
as soon as possible.
ENT, optimize diabetes, optimize the blood pressure, optimize the anxiety, optimize all the other central factors. See the ENT. ENT will then refer you to an audiologist who will then do the quantitative analysis of the inner ear, which is a VNG and audiogram.
Okay, Abdulhamid, Jazakallah khair for the call. We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Hello, assalamu alaikum.
Who are we speaking to?
I've been enormous, right?
Gee, no problem.
Gee, what's
I recently find out from the doctor.
Gee.
Yeah, I've been for a tonsil operation and a nose.
Gee.
So now what happens, my ears are paining a lot, the left ears.
When did you go for the operation?
Paining a lot. Yeah, and then my tonsil is eating, and my throat is eating.
How long ago
what is the cause of it?
How long ago did you go?
About a month back.
Okay, I think it's probably still within the norm to have a little bit of discomfort still about a month later as an adult for tonsillectomy. So I would say just give it time.
I use a mouthwash,
Gee. Yeah, absolutely. So I would say a month post tonsillectomy. Tonsillectomy in adult is
it takes a bit longer to get.
It takes longer to heal, and it is notoriously painful.
Yeah.
So when you have a wound and the wound is healing, you go through stages of pain, then pulling, then you get a bit of itching, and your tonsil is notorious as an adult tonsillectomy. It takes notoriously long to heal.
So it'll take a little bit longer, and then if it still persists after another 3-4 weeks, then you should probably go back to your doctor.
Gee,
You should just give it a bit more time.
If there's fever, or if there's especially from the nose, if there's a pussy discharge or mucus discharge that's yellow or green in color, see your doctor sooner. But if there's nothing like that, no other fever, just the congestion, I would just do the post-op. What we would normally give for sinus and tonsil is the steaming and the washouts and the long-term medication.
Jazakallah, brother. I hope that is helpful to you. We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
What's your name, sister?
My daughter. She's 4.5. When she was 2.5, her eardrum burst because of very bad middle ear infection.
Yes.
I taken her to 2 ENTs. She's had grommets put in twice, but these middle ear infections keep coming back, and it starts with her nose running, and from that she develops like a postnasal cough. I'm told that's what it is, and then her ear starts leaking thick yellow fluid, and she gets a very high fever, and she's not herself for at least 5 days or so.
Gee.
This is a very common problem, Khalil. So it's a good question.
Yeah, this is a very good, important question, because the misnomer is that the grommet solves the ear infection. And remember, the grommet doesn't actually solve the ear infection. The ear infection can cause complications, and the biggest complication is hearing loss due to two reasons. One reason is a rupture of the eardrum, and one reason is the infection can actually make its way into the inner ear and cause an inner ear infection and an inner ear loss, which is essentially neural hearing loss. The third way the middle ear can cause a complication is it actually can breach the roof of the middle ear, which is into the brain, and cause a meningitis. So the grommet is not intended to solve the middle ear problem, or rather to completely solve the middle ear problem. The grommet is intended to prevent complications. So it is therefore for 3 reasons. Reason number 1 is to allow the pus to leak out, as you would think of a middle ear infection as an abscess. So it's a closed cavity with a buildup of pus within it. So you need to drain that abscess, and the best way to drain it is to make a hole in the eardrum. And that would be what we would call a myringotomy, not a grommet, just a hole. That would be lancing an abscess. But unfortunately, the eardrum has a good capacity to heal. So even when a child has a ruptured eardrum, very quickly, within 2 to 3 days, it can heal. And then you're left over with a closed abscess again. So what we do is we put a grommet in, which basically keeps that hole open. So it allows the drainage, that's first thing. Second thing, it allows ventilation. It allows air to go in, releases the pressure, and then a lot of the mucus can drain down the natural way, which is the eustachian tube. And the third important reason for the grommet is so that you can treat the middle ear infection with antibiotics that are topically available rather than orally, because you're treating directly into the middle ear. So the most important thing is to treat the leaking ear is to, number 1, treat the underlying risk factors. And you hit the nail on the head to say it always starts with the flu. Always starts with a runny nose, because ultimately the source of the infection is almost always the nose. Rarely when you dive in water and you get a bit of infection from the outside, that's the exception. The rule is the ear infection starts off from the nose. So we must make sure we treat the risk factors, and I think we've been through them already. If there's an underlying risk of allergy in the family or for that child, you have to manage that allergy appropriately and aggressively if you're getting recurrent ear if you're getting recurrent leaking. If there's smokers in the family, I have to be blunt, they have to not be there. Let's be blunt. I mean, this is the bottom line. Third thing is, if there's a preschool attendance, if the child is young enough and if there isn't a have to go to preschool, you have the option of taking your child out of preschool. I'm not advocating that in certain age groups, but certainly you have to weigh the pros and cons for your family and say, well, a 3-year-old child, maybe we can keep them off for the winter or take them back in the better months. So control the risk factors. If reflux is a risk factor, manage the reflux. If position is a risk factor, or obviously the 4-year-old is not that relevant, then manage the position. But you've got to manage the risk factors, sometimes very aggressively. But don't worry about the leak. The leak is the way of, well, it's saying the grommet's doing its job. It's undesirable and must be treated, but it is better than having a closed ear infection.
But a lot of these children end up with repeated antibiotics over and over and over again.
Yeah.
And this is a problem because they're not treating the cause.
That's right. So
and the antibiotic is only a secondary cause for the infection. Yeah.
You've got to treat the underlying. You've got to treat the risk factor. The risk factor treating is far more important than treating the consequence. So my feeling is that, sometimes you'll be happier with a continuous low-dose medication for the entire 6 months, which sometimes I understand is undesirable, but that outweighs the rescue medication.
So when you're talking about prevention, right, obviously you're talking about antihistamine syrups, and then you're talking about nasal sprays.
Nasals, yeah.
Is there a particular order?
Well, my preference is nasal spray first. It's topical. It means that it's not very, very low systemic absorption. And the big advantage of nasal sprays over, and we're talking about intranasal corticosteroids, we're talking about corticosteroid sprays. And I know when people hear corticosteroid sprays, they go steroids. And I think that, we want to put it to rest that the dosage is so low that it is irrelevant in the grand scheme of things, compared to, for example, a rescue dose of oral cortisone or antibiotics. So my preference is sprays first and antihistamines. And the second reason why it's superior to antihistamines is your body gets used to antihistamines, which means you have to withdraw them. And then you have that period of time when you don't have them.
Okay, we have another caller. Assalamu alaikum.
Walaikum salam.
Assalamu alaikum.
Can you go ahead with your question, brother?
Right, it's Umi from Pretoria, yeah? Can you hear me?
Yes, we can hear you.
Okay, doctor, I was watching the TV, and 1 month ago they did a scope for me.
Yes.
And that was January the 8th. Can you hear me?
Yes, we can hear you. Carry on.
Go ahead.
Right, the surgeon did the scope, and now every night I get up at 3 o'clock and I rush to the toilet. So the cluster didn't help me, no antibiotics. So this morning I went for my blood. Then the surgeon phoned me, he said the one blood report is very bad and tomorrow he's sending me for a scan.
Wait,
so what condition are you talking about, brother?
Yeah, what scope did you undergo? What scan,
Right, my ulcer burst on the 8th of January.
Right.
Okay, so you went to a stomach specialist, brother?
Yeah.
Yeah, today we're discussing, we got an ear, nose and throat specialist here. So we're not discussing stomach issues.
But is he doing the right procedure?
We won't be able to comment on that tonight because our specialist here is an ear, nose and throat specialist.
So,
sorry about that. We're discussing ear, nose and throat conditions. Okay, so that was a caller for a different condition, although we can attempt to answer that, but we want to focus on the topic and give people a chance, otherwise our time is limited. Until we get the next caller, Khaleel, I mean, we've touched on a whole host of things here which have been so important.
Usually happens when you're
and it's so important, this whole grommet issue. Another call is coming through now, but I think that grommet issue is very good, and thanks for the clarification. Assalamu alaikum, we have another caller.
Walaikum salam.
What's your question, sister?
I just want to find out, my mom is 65 years old and she has a problem with her lips and her tongue shakes a lot.
Right, lips and tongue shape a lot. Look, just offhand, I think that's most likely neurological. Right, because whenever you have got a sort of what we call a twitch or a dyskinesia or something like that, often the problem is sitting in the nervous system. like a bulbar or pseudobulbar palsy, you know, that classic sack of worms.
Cranial nerve thing. Sister, what other problems does your mother have besides this?
Does she have a dry mouth? Any other E.N.T. issues that could be related, that may be also troubling her?
Hello, are you there still? Okay, the caller is gone. Okay, but I think you answered a question that could be more neurological, and she'll probably need to take her to a neurologist. And
if you are listening, sister, I think
if you are listening, get it further checked. Yeah. So Khaleel, now one of the other things that we get very often in our practices is patients coming to us with sinus problems, right? And say, I got sinuses, I got sinuses.
Well, we all have sinuses.
Yeah, that's the whole question. It's good you said it, because I tell them the same thing. But the thing is, when the sinus becomes inflamed, then it becomes sinusitis.
Yes.
And then they get recurrent sinusitis, and eventually they get fed up and they reach a limit of tolerance, and they end up going under the knife in surgery. And then they come back about 5 or 6 years later that, the surgery didn't help me. And this has become a bit of a problem for us, because obviously we know there are success stories, and there's definitely indications for sinus surgery, and the success rate is reasonable.
Absolutely. 100%.
Okay, we have another question. Maybe we'll come back to that.
We'll come back. I think it's a good, important question to answer.
Assalamu alaikum.
Walaikum salam.
What's your question, sister?
I just want to, that in the night when I sleep, middle of the night, I cough a lot.
Right, yeah, absolutely.
And then, sometimes I cough so much that my chest starts paining and burning.
Right, okay, so you're talking about a chronic nocturnal or nighttime cough.
Yeah.
Dry cough or wet cough?
I would say dry, but then I cough so much that I try to take out the mucus.
Yeah, mucus, yeah.
Are you a smoker?
No.
Okay.
Okay. So look from a dry cough, obviously whenever you have a chronic cough, you've got to investigate the entire, what we call united airways. So you've got to start from the tip of the nose right into the lung. So I think you need a comprehensive evaluation of all of the things, but often we can tell you that obviously sinus problems can cause postnasal drips, which can cause chronic coughs at night, and the other important one is reflux from our point of view. If you speak to a pulmonologist, obviously you need to think about chronic bronchitis, you need to think about, TB, asthma, all of those other things. Chronic coughs, obviously, when you have chronic cough, you always think, you have to investigate it.
Yeah.
But sorry?
I have hay fever.
Hay fever, yeah. So that's something. The sinus problem and the hay fever causes a postnasal drip, and the postnasal drip would then, drip down on your larynx, that's your voice box, and would cause you to have a nocturnal cough. So, I think you need to go through the entire algorithm of chronic cough evaluation, which would be an E.N.T. and a pulmonologist.
Do you have a history of asthma, sister?
My father had, not me.
So you've never been put on any pumps, asthma pumps or anything, even as a child?
No.
So I think
the good place to start.
Yeah, it's a good place to start is to get the whole profile checked in terms of asthma, which is one of the contributing factors to a night cough, and could be the cause or the E.N.T. cause.
That is reflux and postnasal.
Yeah, so there are 3 particular things that need to be checked. So your first port of call maybe to the GP for him to try and differentiate which way you should go first.
Okay.
Perfect. And obviously, at the appropriate age, a simple chest X-ray would be warranted.
Yeah, of course, definitely. Jazakallah for the call. So we were discussing the sinusitis surgery. Yeah. Maybe you can just expound on it a bit.
Yeah, we always get that. People always come to us and say, well, sinus surgery has not helped. And I try to break it down very simply to them to say that, look, there's essentially long-term factors and short-term factors. And the long-term factors are related to your age.
We have a caller. Shall we take him first?
Oh, yeah. No, we can. Let's take the caller. Yeah.
Assalamu alaikum.
Wa alaikum salam. Doctor, am I speaking to the doctor?
Yes, you are.
You got us.
Doctor, I am suffering from, wax problem in my ears. Every few months I have to go to a doctor to have the wax shrinked out. It sometimes causes a lot of itchiness and infection. How do I go about, having this problem, sorted out?
Sorted out, yeah. Look, like some people have got thick hair, some people have got thin hair, some people have got, more sweating, some people sweat less, some people produce more wax and some people produce less wax. So I think the strategy around controlling wax is to be able to manage it rather than completely cure it. Unfortunately, we cannot cure it completely, but we can manage the factors around it and try to make it a bit thinner and try to make it and simplify so you don't get complicated each time. When people come to me for wax removal, we always try to iterate to them and reiterate to them to say that wax is only removed when it causes, number one, pain, when it causes hearing problem and blocking your inner ear, and when it causes difficulty for the person examining to examine the middle ear. So I use those as 3 reasons to take out the wax. Wax doesn't have to be taken out just for the sake of taking it out.
But you want to mention earbud use?
Yeah, and then you've got to find out what predisposes people to wax. So some people are predisposed, and the other is habitual using earbuds, or we call them Q-tips, into your ear, and they shouldn't even be called earbuds. They're not meant for the ears.
Yeah, that's right.
So Q-tips. So when you actually use a Q-tip, you're not really doing. You're not really taking it out. All you're really doing is pushing 80% of it out and pulling 20% of it. Pushing 80% in and pulling 20% of it out. And we always laugh about it, and I'm pretty sure everybody's heard it. But the only thing you should be putting into your ear is your elbow, right? which basically means nothing. So I'll tell you what's a nice strategy, because if you're getting itching and you're getting pain, your itching is probably maybe a little bit of water going inside, causing a bit of maceration of the skin, and that can cause itching. And then sometimes what happens, you scratch it a little bit with a bit of an earbud, or maybe with a pick or something, and you cause a bit of an infection, and then you get the pain. So for me, the general strategy is to keep the wax as soft as possible. So I go back to the old remedies of simple almond oil, and provided you know that there's no perforation of your eardrum. So first, have your ear checked out. Make sure you have no perforation of the eardrum. Simple sweet oil or almond oil, once or twice a week, just to keep it soft. It will not necessarily prevent the wax, but at least it will keep it soft so that it can come out easily in the future. Wax oil and all of that is only intended for use prior to actual syringing, because it dissolves it, and then once it hardens again, it's stuck inside.
Talking about it, your preference, Waxol, Cerimol, one seems to cause more inflammation. No, they're all the same?
They're all the same to me.
Okay.
I mean, some people say Cerimol, some people say Waxol. Waxol is supposed to cause more inflammation.
Oh, yeah.
But if you ask me,
okay, so that's
they're not intended for long term.
Right.
They're intended for acute use, which you put them in, wash the ear out, and that's
it. Okay.
Don't put them in every day. If you're putting something in every day, put some almond oil.
Okay. Okay. We have another caller. Assalamu alaikum.
Wa alaikum salam.
Go ahead with your question.
Okay. I suffer with blocked nose almost every night. And it's like when I'm sleeping. If I sleep on the right side, it gets blocked. When I turn to the left, it's blocked on the other side as well.
Gee.
And it's going on for years.
Gee. Are you on any medication, sister?
No medication.
Okay. Now, what you're describing classically is what we would call a dependent rhinitis, which means that the side that's lower, which is the dependent side, becomes more swollen. And that is not actually an abnormal phenomenon. That is a normal phenomenon. But obviously, in people who actually suffer from complete blockage on the side which is lower or dependent, it is an exaggerated phenomenon, right? So essentially, it means that your baseline swelling inside your nose is probably above normal, and maybe you've got some anatomical problems inside the nose. So my suggestion is start off with a nasal spray to see whether you respond. Nowadays, all the good intranasal corticosteroids are over the counter. So start with the over the counter intranasal corticosteroids, see what happens, and then see your GP if you don't respond. So if you don't respond, see someone. But if you respond, it's fine. The other things you can do is do steaming. Steaming helps a lot. And some saline, just ordinary salt water washouts with a neti pot, or just the sprays that you get over the counter.
Okay,
Jazakallah, sister. Okay, so we haven't got a caller. We interrupted your sinus surgery thing, and let's carry on with that.
We were actually saying that essentially it's not caused by one thing.
Okay.
Right? It's caused by multiple factors. So obviously the long-term factors are related to, we call them building blocks. So one block is age. Right? One block is fitness. So the more unfit you are, cardiovascularly or otherwise, the more poorly your nose responds. And I think it's even relevant to the previous caller. Your nose responds with fitness by the blood vessels emptying out and filling up. And if you're not fit, they fill up and then they don't empty out. So fitness, age, hormones. We know in pregnancy women are more susceptible to blocked noses. So pregnancy is one aspect. Then we've got allergy. Allergy is a long-term and a short-term problem. And then we've also got anatomy. For us, the biggest block in that entire puzzle is anatomy. So if you've got abnormal or unfavorable anatomy, you are more predisposed to sinus problems. And then the short-term side, it's allergy again, and then infections, viral, bacterial, and other, and then pollution, humidity change, temperature change, all of that. Suddenly people say the air conditioner affects me. So there's short-term factors and long-term factors. Certainly most of the factors are dealt with medication, and those medication are basically anti-inflammatories. Because, you know, I always laugh and I
We
say...
got another caller, Khaleel?
Another caller, okay.
Yeah, come. Assalamu alaikum.
Alaikum salam.
You can go ahead with your question.
The doctor's really talking.
No, no, you can go ahead.
Okay. Alaikum salam.
What is your question?
Doctor, whenever I go overseas, and when I was playing lands, my ears playing terribly.
Gee.
I don't know what to do about it. They said I must chew chewing gum, but nothing helps.
Gee, what happens is when
It's a common problem.
It's a common problem, especially what happens when you're landing. Your environmental pressure, air pressure, is changing because they've got to adjust the cabin pressure to match the outside pressure. So often they do that in the last 15-20 minutes of the flight. And what you have to do is you have to make sure your underlying problem, sister, is that your eustachian tube, which is responsible for maintaining your middle ear pressure, is dysfunctional. And the commonest reason for that is a sinus problem. I think you can listen on the TV. The commonest problem for that is a sinus problem. Okay. So the chewing helps because it opens up the eustachian tube. But if it occurs very regularly, our suggestion is to take a decongestant before you take off. And if it's a very long flight, more than 6 hours to 8 hours, which is the duration of action of the decongestant, take one an hour before you land as well.
Khaleel, you just want to mention one or two decongestants. I know you're not punting anyone, but
yeah,
just,
you know, I would say Sudafed, just Sudafed, you know, Actifed, but they're all now scheduled, highly scheduled drugs.
Yeah, they're highly scheduled.
So
you'll have to consult your doctor, tell him you got this problem, and then carry this with you. And as Dr. Khaleel said, that you're going to take it before the flight, find out when you're landing. So if you're going from Joburg to Durban, you're only landing within an hour.
I would say take it before you take off.
Before takeoff.
So it'll cover you for both.
Yeah, but if you're going to land in Dubai, for example, you may have to take two when you depart, and then again when you're on the flight.
Absolutely. And sometimes you can even take a little bit of anti-inflammatory, such as ibuprofen, together with that. So I would say a good combination would be Advil CS, because it's got the decongestant and the ibuprofen. So I'm not punting it, but it's an easy one to remember.
Okay, sisters, I hope you were listening to that. I know you dropped the call, but I hope you could hear that answer, a very good, important one.
And treat the underlying sinus problem.
Yeah, and you got a sinus problem, that's what it's telling us, so please treat that also. We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Go ahead with your question, brother.
Doctor, I got a problem. Every time I get out of the bed and then I feel very dizzy, I walk around and all of a sudden I feel dizzy now on the floor. I must hold on to something, or otherwise I just have to collapse.
Okay.
Now, I can't balance myself at times, but it doesn't happen all the time. But I can't help balance myself on time, and my head starts paining, and all of a sudden in my brain something happens that completely, put me off everything. I can't think properly, or can't see properly, or anything like that.
Okay, brother, I think that sounds very much like pre-syncope.
Okay.
Right? It sounds like it's in the right context of sitting up, from lying down to standing position. Tell me something. Do you feel a sensation like you described it, that you can't see properly, you feel the pounding in your head, and do you actually feel a sensation of spinning?
Yes, I do.
Okay, G?
Yeah, and then a thing of spinning, and then all of a sudden my leg become very, like a chair-like jelly that I can't stand on my feet at all.
Okay, and
then,
do you have
and most of the time my head is spinning. And when I'm worried about something, all of a sudden my head spins and everything, and I can't stand. I go to a hole against something or whatever.
Okay, I think we had a previous caller who actually described dizziness, and I think what happens is you need a full workup. I think you need a workup that includes your blood pressure and all of that, together with what we had described before.
Yeah.
Because I think you're describing two situations.
Correct.
You're describing a pre-syncope, which is pre-fainting, and a vertigo.
Yeah.
And I think a more in-depth assessment of which one is the dominant one. I know when you're stressful, it doesn't cause the problem. Remember, it aggravates the problem. So you have got an underlying problem with maybe blood pressure and whatever, and that part has to be deconstructed, and then the vertigo, which is the true spinning, has to be deconstructed, and the two have to be defined properly and see which one is the dominant one. To me, brother, it sounds like you got a little bit of both, and therefore you need a full workup of the entire, of both of them.
Brother, have you consulted anybody, or have you had sought treatment for this?
Heart specialist, right? And
Yeah.
they check my lungs, they check my heart, they check every artery, everything. They did an angiogram, everything. They say they can't find what is happening to me. All of a sudden, my oxygen is we can't find why it's happening. Now, where do I go now?
Okay, so he has been for some treatment and investigation.
So it looks like they had the heart, which is very important, arrhythmias,
Yeah, that's
and,
right.
and coronary artery disease,
Yeah.
and obviously carotid artery disease can
So
cause that.
So he seems to have gone for that.
Yes, and vertebrobasal insufficiency, all of that can be done.
So do you suggest an ENT or a neurologist?
I would say my gut feeling is you need both.
Yeah.
My gut feeling is you need both, because it sounds like there's a pre-syncope situation and a vertigo situation.
Okay.
Right.
So I got to go to the neurologist.
Neuro and ENT.
Do you have a GP, brother?
Gee, I have.
Yeah, so go to him first and then ask him to do a referral, right?
Start, I think, good place to start.
Actually, I went to him and he actually took me to one of the heart specialists and everything.
Yeah, but
beat my heart and everything. He said, you know, I'm 67, and he said my inner body is like a 33-year-old, and so forth. But all of a sudden, I just get lame, and I can't handle that.
Okay, I think, brother, you need to go back to your GP and then get a referral to the ENT and the other specialists. And Jazakallah for your call.
In fact, Yakub, I think he's raised a very important point, because I said the vestibular system is dependent on two sides, which is the vestibular and the brain. And remember, when we're dealing with the brain, it's not just the brain, it's the blood supply to the brain as well.
Correct.
Which means that the arteries and the heart must be worked up together with the brain.
It's not an isolated system.
Absolutely.
And that's a message. And
That's a
whenever
very
you're coming
important
to these dizziness and those kind of issues, you can't just compartmentalize it into the ear. It has to be seen, and then obviously it has to be taken from
in context.
In context.
So the central problems include the workup for the brain, the heart, and the vessels. We call them ABC. Arteries, brain, coronary, cardiac, and the workup for the peripheral. So I think the brother needs, I think,
a total workup. He's done part of it, but he needs to go to the next level. Jazakallah, brother. We're going to be wrapping up just now, so Khaleel,
finish on the sinus.
Just finish the sinus, and then perhaps we can just.
Okay. So from our point of view,
sorry, the lines are now closed, and that was the last caller.
That was the last caller. Okay. So important thing is that the sinus issue for us, the short term, the long term issue, which is the anatomy, is important. But remember that the other factors, which is the short term factors, have got to be dealt with medically. So if you have infection, you need to treat with antibiotics. If you've got an allergy or allergic rhinitis, you need to treat with appropriate antihistamines and or nasal sprays. And the only time we actually do surgery, sinus surgery, is we deal with complications, right? We deal with refractory treatment, refractory disease, which means that medication is not working. So then what we do is we don't cure it, we optimize it, right? And then depending on the severity of the original condition, some people have got mild, moderate, severe, or even profound. We can expect a certain degree of recurrence. So if you've got profound illness, you've got a higher rate of recurrence. Maybe in 5 years you'll be coming back. But if you've got mild disease with just an abnormal deviated septum, the success is actually virtually 100%.
So I think from our point of view, when the patients are coming back, I think communication is important.
I think the failure of sinus surgery is the failure of the counseling of the surgeon.
Yeah, I think the pre-counseling for the surgery, and then also post-counseling, it's important. And also not to raise the expectations to that level that you're going to get a cure if you know that you may not. So I think that is the important thing, is to identify the expectation and what you can achieve through your surgery. And I think it's important for people to know that.
You read the nail on the head. If somebody is getting, for example, a complication 10 times a year, and we make that 5 times a year, that's success.
Okay, we've got a couple of minutes that we're going to wrap up now. Khaleel, anything else you want to add for the viewership? And just to say what kind of other take-home messages you sent, 1 or 2 today.
Let's see. I think the 2 couple of important ones.
Yeah. I know the smoking one is a good one. Eh?
Smoking is one important one. A unilateral or one-sided tinnitus, right, must be investigated. One-sided hearing loss. In fact, last year in approximately from March to July, we had about 10 people who lost their hearing. Sure. So sudden onset blocked ear is not something you should say, we'll treat it. Yeah. If I would give you the equivalent for the eye. If you got lost vision in one eye, you would end up investigating it very, very, very quickly. And the ear is exactly the same thing. So if somebody has a blocked ear and they look into the ear and the ear looks relatively normal, that should be investigated urgently, because you can save somebody's hearing if you treat it appropriately.
Okay, Jazakumullah khair, Khaleel. Thank you for coming. We appreciate you taking your busy time schedule. And thank you to the viewers for joining us on Health Matters, comprehensive chat by the Islamic Medical Association. This is going to be a slot every week, so we're going to see you again, inshallah, next time. Next week, this time, our topic next week is psychiatry, and it's a very important one, so please keep it in mind. And Jazakumullah khair for coming through on the show, and for all the callers. And we hope to see you soon, and we love the interaction with you. And from our perspective, our intention is to educate, empower, and to do our best as Muslim health professionals from the Islamic Medical Association. Assalamu alaikum wa rahmatullahi.